Hello there, it's Luke, and in this tutorial we're going to be setting up a group of tutorials that are all looking at hemostasis and coagulation. So in this particular tutorial just now we're going to be exploring ideas about different models of thinking about coagulation and hemostasis, the classical model, which you may be familiar with, of having intrinsic, extrinsic and common pathways, and a more sort of recent way of thinking about things, which is referred to as the cell-based model. So without further ado, here we go. So what do we mean when we say hemostasis? Well, heme means blood, and stasis means stopping the flow of something. So we're stopping the flow of blood leaving the blood vessels when they become injured. And if you've done any study recently, or I don't know, in the last 20 years or so, probably a lot longer, then you may have been presented with a diagram like this showing the extrinsic and intrinsic pathways being started from two very, very different points and coming together to meet in something called the common pathway, which is the sort of end point at which we get prothrombin rather turned into thrombin, which then converts fibrinogen, which is this sort of soluble protein that's in the blood, to fibrin, which is what we make the strands out of, which are going to sort of firm up the blood clot. We're getting ahead of ourselves a little bit here, but this is the classical model of coagulation that you may already be familiar with. And as I've mentioned, we have the intrinsic, extrinsic, and common pathways. And a lot of this was developed in vitro, so in the labs with the blood outside of the body, and seeing how the blood clotted and sort of responded to being in that environment. And one of the problems with it, although it is a useful model, one of the problems is that it sort of suggests the intrinsic and extrinsic pathways are two very separate things. And more we're coming to realise that actually there's a lot more sort of talking between the two, if you like. And it's perhaps not that clear cut between those two. Excuse me. There we go. So first of all, if we think about the intrinsic or contact pathway, it's referred to as the intrinsic pathway because everything that you need to begin coagulation on this side of the pathway comes from within the blood vessels, comes from within the bloodstream. So it refers very much to those circulating clotting factors. It takes a little while to get going. It can take several minutes for the intrinsic or contact activation pathway to get going. And it is stimulated by the presence of foreign objects. So if you have glass or a piece of metal or something like that, if you get, stabbed or have some sort of traumatic event, then it's thought that this pathway is the one that will be primarily involved. And a lot of the study, a lot of the blood tests that we've got to look at the intrinsic pathways come from examining and researching the blood as it behaves outside of the body. And this has a particular relevance to those of us in critical care because we have filtration machines and dialysis type machines that are prone to clotting, certainly ECMO machines, things like that. And also it has some benefit to think about this when we're looking at blood results as well. We then have something called the extrinsic pathway, which more accurately is now referred to as the tissue factor pathway. And it's called the extrinsic pathway because some of the coagulation factors and some of the materials that you need for forming a clot come from outside of the bloodstream, so maybe within the walls of the vessel rather than the sort of lumen of the vessel. Now this is a much quicker acting pathway and it takes seconds to activate, and it tends to be triggered by injury to the blood vessel itself. And so you get the clotting factors and the various cells and things that are within the bloodstream all of a sudden become into contact with these extrinsic factors, and which I really mean tissue factor, which is in the blood vessel walls itself, and that's what triggers this very sort of rapid stimulation of clotting via this side of the coagulation cascade. And the common pathway, as I said before, is this point where the two those two classical extrinsic and intrinsic pathways come together around the formation of thrombin, which is the sort of master factor, if you like. It's involved in lots of different points in the coagulation pathway from this point onwards. But its main job, if you like, is to take soluble fibrinogen, which is created in the liver, and turn it into insoluble fibrin, out of which the strands are made, which then go on to form the mesh, which when added to the platelet plug, which we'll talk about in a further tutorial, reinforce the clot and make it into a much more stable thing. Now, as I've said before, there's a more recent model of thinking called the cell-based model of coagulation, and this focuses very much more on the interaction not only between those clotting factors of the tissue factor and contact activation, or intrinsic and extrinsic coagulation factor pathways, but also platelets and endothelial and subendothelial cells. And instead of viewing platelets and endothelial cells as being sort of building blocks or lumps of clay or bricks or what have you, they're actually a lot more active in the process of forming the clot, and therefore in terms of haemostasis. And there are three stages to the cell-based model. There's initiation of the coagulation cascade, amplification, which ultimately results in lots of thrombin being formed, and propagation, which is that sort of thrombin being used to sort of bring about the change in fibrin and sort of shore up that platelet plug. Now, through these tutorials, we're going to have a diagram all the way through, and very quickly, these are the sort of key players, if you like, in there. We've got platelets, red blood cells, white blood cells. These are the endothelial cells that line the innermost compartment, if you like, the innermost lining of the blood vessels. And then we have what we call subendothelial tissue, which is any of the sort of connective tissue or cells that form the sort of middle, if you like, of the sort of blood vessel wall itself. And of course, we have clotting factors, which are going to be coming together to sort of clot the blood and sort of end in that sort of production of fibrin. So here is a picture, a sort of slice, if you like, through a blood vessel. So you can see the endothelial cells here. We've got some red blood cells in the middle. This is the lumen of the blood vessel, and then we've got perhaps some subendothelial tissue here, and whichever sort of tissue cells these are sort of surrounding that sort of small blood vessel. And this is our diagram representation. So you can see this is the lumen, this sort of white area here where all the blood and those different components are. We can see platelets, red cells, white blood cells, and we have our endothelial layer of cells, and then behind that we have the subendothelial and sort of other tissue cells. And this is going to be our diagram that we refer to throughout the next few tutorials. And surprise, surprise, we've had an injury to our blood vessel, and blood's going to start pouring out unless we develop haemostasis and we have a clot develop to prevent that. And how that comes about, classically we teach this in 5 stages, and we'll go through each of these in more detail in the upcoming tutorials. But essentially you have vasoconstriction of the injured blood vessel. We have adhesion and activation of platelets, which come together to form a platelet plug, and we would refer to that as primary haemostasis. Coagulation, where we have the fibrin formed to produce to reinforce that platelet plug and have a more stable clot. Clot retraction, which we'll explain in a future tutorial. And then finally fibrinolysis, where the clot is broken down when it's no longer needed, and you then have sort of good flow through the blood vessels. So in summary, we've just outlined the 5 stages of haemostasis. We've talked about both the classical model of coagulation with the intrinsic, extrinsic, and I've put extrinsic again here, but I meant to say common pathways, and also introduce the concept of a cell-based model of haemostasis, which talks much more about the interaction between those coagulation factors, platelets, and the endothelial cells. Thank you very much for listening.